My first days of MD path. When I entered my MD path, the first thing when you enter MD path, what you have to learn is doing grossing. That is the most essential step when you start your MD path. Go through grossing techniques which are given at the back of your academy. Even there are many online manuals available online, which are available on Royal College of Australasia and UCLA guidelines, and even a Tata Memorial Hospital guidelines for grossing. These are the apt for learning grossing. Learn basic histology, learn basic all your basic anatomical details of all the different organs which you normally commonly receive in your department. So these are the things which you need to remember when you're starting your grossing. Please don't get shy. Please don't get afraid of formalin. Formalin is going to be the part of your life throughout your life now. So when you manage to learn grossing, now next step comes how to go about learning basic histology. Take up a very good basic book like Vitas or any other book, maybe Sternberg Histology for Pathologists, which you have consulted in your early days of MBBS. Use that book. See the basic histology, how the basic, if you don't know the basic, how will you graduate to something which is pathological? Then the other foundation book which you always have to read is Robbins. uh, Read the journal path, try to understand the concept what is there in journal path. Even the systemic path chapters written in Robin are very good, but other books which you can consider are Ackerman or Sternberg. There are places where Ackerman is more widely being used, and there are places where more Sternberg is being widely used. But Ackerman, do one thing: read the basic chapters like endometriums, your all your gallbladders, your uterus cervix, all those things you have to remember, understand even the basic techniques like things like leiomamas, cystic follicles in your ovary, and chronic cholecystitis. Even so, when you know the basics, the basic histology or the basic pathology, then only you can graduate towards higher things like maybe oncology specimens. The inflammatory conditions which you normally do. For dermatopath and all, always remember, try to first see how the histology of the skin looks like. The basic terms what we use in dermatopath. Then only you can graduate towards pathology. Don't go directly for super specialized books on liver path or GI path. First, master these books of GI path of your Ackerman and your Sternberg. Then only you graduate towards it. So when you start moving into second year, then when you have mastered many of the important routines, specimens which you get every day in your department, then only you have to graduate towards the higher or specialized areas. About hematology, always use the basic books like Dikruchi, then only you go towards Winthrop. And for cytology, oral is a very good book for learning the basic cytology. For I'm sorry to say, there's only course is available, which is a very good book for cytology fluids and all. But there are many other books which have been written by Indian authors which are quite good. Those also you can consult. But cytology is something which you learn more by doing and doing it and again and doing. And definitely there are good books to guide you, but see, and use very important sites like pathology outlines, use your PubMed, and start reading every day. A pathologist is the one who has to read throughout there. So please don't be afraid to read every day, and you will be the guiding force for all the clinicians. But once you have made a decision for MD-PAT, please don't revert back, because this is a field where you will be away from your stethoscope and will be more closer to your microscope. So move ahead. You will really enjoy this journey. Thank you.